APTN presents a captivating journey into the heart of the North with our latest podcast, The Place That Thaws.
Some areas that used to be safe are no longer safe.
Hosted by me, Danielle Parody. Join us as we uncover the intricacies of life on a changing coast. Subscribe and listen to The Place That Thaws.
Good evening, I'm Dennis Ward, and this is Face to Face. Our guest this week is Dr. Rebekah Neckoway. Dr. Neckoway is from Thunder Bay with roots in Yabamatung First Nation and Fox Lake Cree Nation. She earned her nursing degree from Lakehead University and attended medical school at the Northern Ontario School of Medicine. In December 2023, she was announced as the Chief Medical Officer of the Matawa Health Cooperative, marking the first time an Indigenous Chief Medical Officer has been appointed in Ontario. Dr. Neckoway, great pleasure to have you joining us this week.
Thank you for having me.
Well, as we mentioned there in the intro, you were recently appointed the Chief Medical Officer for the Matawa Health Cooperative, the first Indigenous CMO in Ontario, and I think maybe one of two in the entire country. How does it feel to be breaking new ground like that?
Thank you so much. It has really been an honor, and it has, I hope, set a precedence for, all other provinces and territories in Canada. And I look forward to not being the first or only Indigenous CMO in Ontario, but hopefully will be accompanied by many others.
A lot of people who say that, they break the ceiling and they say, it's great to be the first, but I don't want to be the only one.
That's right, yeah.
Can you tell us a bit about what the role entails?
Yeah, I am very lucky and privileged to hold this position at the Matawa Health Cooperative, which is part of Matawa Tribal Council. I work with a group of wonderful leaders, and we are basically trying to provide primary care services in an interdisciplinary team to the 9 Matawa First Nation communities.
So, like you say, Matawa represents 9 First Nations in Northern Ontario, 5 of them only accessible by winter road or by air, roughly 10,000 people though. What are some of the health challenges that they face?
So I just tend to take it back to the basic, necessities in a lot of these communities, and how a lot of them aren't being met. So things like all access roads, like you mentioned, 5 of them are remote and so only accessible by plane or by winter roads. And with climate change, who knows what the viability of winter roads will be going forward. So what I'm trying to get at is that with lack of access to suitable healthcare or basic necessities like water, even Wi-Fi, internet, and things like that, it really creates a system that has caused a lot of the health problems that we're seeing today, such as high rates of diabetes, mental health issues, addiction issues, things like that.
We've often spoke here on the news about, somebody in a northern First Nation as opposed to being in the city. Stepping on a nail is completely different than if you were living in the city.
Oh, yes, absolutely. Because if you stepped on a nail, you could probably get an x-ray in the emergency department that day, have a physician lay eyes and lay hands on you to remove that. Whereas in remote communities, there may or may not be x-ray services and definitely may or may not have a physician on hand to assist.
Which then leads to other costs, having to fly people in and out of communities for something so simple, right?
Oh, exactly. The cost is definitely high, but necessary because these are, communities that were created by things and institutions like the Indian Act. And so I feel like it is the government's fiduciary responsibility to bring those health services either to the community or bring that community member to those services wherever they are closely available.
Absolutely. You're used to providing Northern First Nations with the medical care they need. Do they all have unique challenges?
Oh, definitely. I've had the honor of attending or being in 13 of the NAN communities that service the majority of Treaty 9. And each one is so different. But I have to say one common thread that I've seen is that the sense of humor of the patients and the people that I encounter is like unparalleled to other areas where I've worked. Right. So it really is a joy to work with the communities.
You're often based out of Sioux Lookout at the Menoyawan Center, a place, as I mentioned to you, that I've been many times as a journalist. Pretty newish, big hospital that serves as a hub for Northern First Nations. But are there still difficulties? Well, there are, I guess, in attracting medical professionals?
Yeah, so I had the privilege of working with my colleagues who work in the Sioux Lookout Menoyawan Health Center for the first 8 years of my practice. I have since moved to Thunder Bay and primarily am based here, but still have all the love and support of those physicians who still work there and provide the necessary work required, especially in such like a human health resource and physician nursing shortage that we're seeing right now across the country and even the world. I feel like it is very difficult to recruit those necessary skilled workers to be able to keep like doors open, like emergency rooms. And as we know, some emergency rooms across the region have had to close, unfortunately, which then creates further delays in care for patients and people of Ontario.
How would you describe the state of the healthcare system in Canada or in Ontario?
I think there's been a lot of media coverage on it, and I think that there has been calls out to different levels of government for increased funding. I know right now, speaking as a family physician, I feel like primary care is something that's very difficult to access right now. I think there's a number out there of more than 6.5 million Canadians do not have access to primary care. And that is quite alarming considering how primary care practitioners, whether you're nurses or physicians, are really the backbone of the healthcare system.
We've heard a lot since the pandemic that, the healthcare system is really in its own state of emergency, although I think that maybe just made it more obvious. But what do you think is behind the situation we found ourselves in?
That's a really good question. And I know there are people way more qualified than me who are speculating on this. And I think one of the common threads that I have heard is basically funding.
Well, aside from that, I guess, what's needed to improve the situation? How can we attract more people to the medical profession?
Again, this isn't really my area of expertise. There are many other people who advocate for this. And things that I've heard them saying is re-examining the almost business model of primary care and how it's funded, how service delivery is given. I know a very big barrier for family physicians right now is a high administrative workload. So meaning the paperwork that we have to do in primary care, it can sometimes be above and beyond the clinic days that we're actually doing or the clinic hours. And so looking at how to fairly and properly compensate that, I think is also one of the solutions that needs to be looked into.
I have some doctor friends who say that exact same thing. Dr. Neckoway, more to talk about here, but we've just got to step aside for a quick break. But stick around, there's more face-to-face to come.
Hello, I'm Rick Harp, host of APTN News Brief. a daily podcast version of the nightly broadcast of APTN National News. Available on all major podcast platforms, APTN News Brief is your quick way to hear the headlines every weekday morning. Learn more at aptnnews.ca/podcasts.
Welcome back to Face to Face. Our guest this week is Dr. Rebekah Neckoway, a physician practicing in Ontario, the first Chief Medical Officer of Health in that province, Indigenous Chief Medical Officer of Health for the Mattawa Health Cooperative. Dr. Neckoway, what drew you into healthcare?
Many things. So I guess as a young person, you want to go into a career that's meaningful, that gives back to others, and also is something that will always be around. Like doctors will always be needed. And coupled with, I had a friend's mother who was a nurse, and she was one of the most kind, caring person or people that I knew. And so choosing nursing as my undergrad was an easy choice when I knew that, wonderful people like her were in the field. But I always kind of had my sights set on medicine. And I knew that if I didn't get in right away, I could still work as a nurse because medicine is a competitive field to get into. And then what drew me in was, especially to First Nations health, is when I was attending the Northern Ontario School of Medicine, we got to go to remote First Nation communities in our first year. And during that time, I went to my mom's home community of Yabamatang. And I remember being in the visiting health professional office, just doing probably my schoolwork. And this little kid came along and was kind of like playing hide and go seek with me. And his mom found him and said, "Oh, you must be Charlotte's daughter." And I said, "Yeah, I am." And she's like, "You're becoming a doctor, right?" And I told her I was. And then she looked at her child and said, "This is your cousin. She's going to become a doctor." And that just meant so much to me because growing up in Thunder Bay, I didn't see myself in like the physicians who treated me or even the nurses, definitely not the teachers or principals. And so I recognized that I was becoming a role model that I wish that I saw when I was a kid. And so I hope that by providing the care that I do, it shows other, teens, adolescents, youth, young adults, anyone really, that we can do this type of work and we can care for our own people and hopefully do a more empathetic job at providing that care. So that's a long-winded answer why I'm in this field.
That's an amazing answer. Thanks for sharing that with us. Your parents are both highly educated as well. Your father from Fox Lake Cree Nation in Manitoba holds a PhD in social work. Your mother a master's in education. Did they play a major role in your career trajectory?
Oh yes, 100%. I definitely wouldn't be who I am or where I am without my parents. And it's going to make me emotional to talk about them. Just because they mean so much and they went through a lot because they're both survivors of Indian residential school. And I think we all know that, most children who went through that awful system did not make it out either alive or in such a great position. So yes, they're my heroes.
Good stuff. I didn't mean to get you emotional there, but
that's okay.
I had mentioned, I had a bunch of friends that went through medical school. It's a long haul, one that really has to start, back in high school. What was your experience?
I really enjoyed medical school. I wish I could go back and do it again just because of the friendships that I created, who, I still rely on now. It is a long haul. So it took me 10 years of post-secondary to get my, full MD and family physician license. and it is true. Those things need to be started back in high school. And so, making sure that you're experienced at studying and working hard and giving back to your community, those all start way back in the high school years.
What, I guess, through all those years, what kept you moving forward?
I think maybe it sounds nerdy to say, but I do love learning, and I do love, learning new things, gaining new skills. And I think anything is what you make of it. So I just made sure I was having fun and creating new relationships and collaborating and, finding the time to have a balanced lifestyle during it all. I mean, easier said than done. There were times where things were definitely out of balance. But yeah, I think once you find an area that you're really interested in, and it doesn't have to be in medicine, it could be in literally anything, it doesn't become like really, really painstaking work.
Yeah, I always say I would love to have been a lifelong college student. Were there other First Nations or Indigenous students in school at the time with you, or did you have those that you looked up to?
Yes, so there were a handful of us. One of my best friends currently is someone who I met in medical school in our orientation week. And she was has been so instrumental in who I am today, because we were so opposites. She was definitely more this fiery, go-getter, social justice advocate. And I was a bit more timid, held back a bit, or diplomatic, as she called it. And everyone just didn't understand how we were friends, because we were kind of like yin and yang. But we ended up finding this balance where she helped me find my voice and my inner advocate, and I helped her become a bit more smoother around the edges. And it's great that we've continued to be friends.
Balancing each other out. How important, you mentioned, with that's your cousin there, she's going to be a doctor. How important do you think it is to have an Indigenous family physician, though, showing up in these communities, practicing full-time in First Nations?
Well, I think it makes it, I would love to hear from the patient point of view or my family, but what I can imagine is that I think it helps with building trust, because people know my family members, people know that I've actually been in the community and know who certain players are or people are. And I think when they see me coming back up after, say, months or years, that boundary or that, maybe fence that people put up comes down a bit, and they're able to trust more, because it's no secret that historically the medical system has done very egregious things against First Nations peoples. And so I think there requires a lot of healing and the reconciliation piece of building that trust and building those bridges. And I think if someone looks like you, is from your, community, or you at least know their cousin or their uncle or their go-go chomish, that it just creates that familiarity.
Right. Good stuff. Dr. Neckoway, more to talk about here. We just have to step aside for one more quick break, and then we'll continue the conversation here with Dr. Rebekah Neckoway on Face to Face. Stick around.
I'm Kathleen Martins, a reporter with APTN News. Homeless, houseless, shelterless people, they aren't hard to find in Winnipeg. They're on the sidewalks, in bus shelters, and down alleyways. They're living in tents and squatting in empty buildings. They're even sleeping in abandoned cars. But who are they? Hear their stories in my new 5-part podcast called Our Relatives. Listen on your favorite player.
Welcome back to Face to Face. Our guest this week is Dr. Rebekah Neckoway. Dr. Neckoway, how do you think we could get more Indigenous people involved in the health sector, but also in leadership roles in the health sector?
I've heard the phrase, it's hard to be until you see, being said. And I think that's true, is if you start to believe that these positions, these roles are only meant for non-Indigenous people, because that's historically who we have seen in these roles, we almost start to believe that that's just how it's supposed to be. So I think having more people be visible, like doing news or radio is not like within my comfort zone, but I know that it is my responsibility because I am in this position. I have this privilege to be at these tables in these settings and to be able to say like that we can all do this, and that maybe it takes some training to be comfortable and have that confidence, because I know that's what it required for me to be in this position. I'm currently doing a Master's of Health Sciences in Health Administration at the University of Toronto, and having that degree has helped me feel prepared and ready to do this role.
Well, I can get the TV is not your comfort zone, but we do appreciate that you're doing it with us this week. The Northern Ontario School of Medicine, I would say, is a little different than some other schools, but some of the other doctors, physicians that we've had on the show have spoken about, some of the challenges that they faced because they were Indigenous in school. Did you have any of those experiences?
Yes, there were experiences like that. And I think what helped me get through them was having, again, my close colleagues who were also Indigenous, and we could rely on each other just to kind of get through that. I think that thankfully there are a lot of people who are bringing their experiences, their negative experiences forward, and I hope that it is a chance and a time where these institutions who have been historically, westernized, are taking that feedback into consideration and creating, different policies, different procedures, different positions. And I am still active in the Northern Ontario School of Medicine, which is now a university, and have seen some of these roles change so that there can be, more support for learners as they go through. I'm not saying it's perfect by any means, but I like to see that it's heading in the right direction.
Why do you think the healthcare sector is one of these big institutions that there's such, racism and discrimination in?
Oh, well, I think it's all historical, right? And I think it all stems to things such as like the doctrine of discovery and, people thinking that when they came from Europe that no one else lived on this land, and that, they had to create harmful policies like the Indian residential schools to kill the Indian in the child. So all those prejudices, unfortunately, I think still live today. And I'm glad to see things like the Truth and Reconciliation Commission and the 94 calls to action that are slowly, turning the narrative and changing the tide. And I think that, again, when more, as it is going to happen, when more Indigenous people go into these spaces, you become like almost like, the right word is escaping me right now, but you start to influence your circle of people and hopefully help them, unlearn those prejudices that they previously had lived by.
Right. Dr. Neckoway, down to our last 30 seconds, but just wanted to ask you quick, what would be your advice to those looking to get into medical school, become a doctor?
I would say that it has been a wild ride, and it has definitely helped me live the life that I want to live. I don't think it's a secret that physicians make a good salary, and being able to have that opportunity to create generational wealth just gives like a nice peace of mind, and it also helps me do things that I never thought I would be able to do. So for example, traveling is a major love of mine. I met my husband overseas and have like been to 37 different countries, and I honestly think it would have been difficult for me to do that in another, field of work, just because of the flexibility that I'm also afforded in this role. So all that to say that you're good enough to do it, you're able to do it. Please come work with me and carry on the good work.
Awesome stuff, Dr. Neckoway. Appreciate you so much taking the time for us here this week.
Thank you.
That is all the time we have for this week on Face to Face. I'm Dennis Ward. Thanks for being with us. We'll see you back here in 7 days.
Hi, I'm Annette Francis. Nation to Nation is a political show keeping an eye on Ottawa on how they're affecting First Nations, Inuit, and Métis peoples across the country. You'll meet the movers and shakers of policy in Canada and those who are trying to make a change. Listen to these discussions and more on Nation to Nation podcast. For more, visit aptnnews.ca/podcast or subscribe and listen on your favorite player.